exactly, yeah.
And usually we find, we've all seen stories of morbidly obese individuals, people who are 600, who weigh 600 pounds, 500 pounds. And when we see their stories in the news, they're always, you know, going through this struggle to survive the obesity that they're going through, try to turn their life around.
Right.
Is somebody like that a candidate for liposuction to save his own life?
Absolutely.
Because if the person, let's say the person, because of their weight, they don't leave their house. They're just sitting down all the time.
I know. Actually, this is really sad, I know, but when it happens to people. But liposuction is not for those patients.
Why not?
Because you can't just do it because it's not safe. How much you're going to take?
Yeah, yes.
Doesn't matter how much.
This is what I want to ask about.
Because if you take too much, this will jeopardize the health of the patient.
How so? If you take too much fat?
You take too much fat,
yeah,
because you're taking also fluid out as well. And the patient might suffer from hypovolemic shock, or the patient might bleed because of overdoing that, or because of the long time of the anesthesia. Anesthesia is dangerous as well.
Yeah, yeah.
Right? If it stays for a long time.
So basically, some people who are very, very fat.
There are different ways that they can lose.
But I've seen cases where people would really go down like a lot of sizes from liposuction, and they end up with very loose skin.
I think those patients you're probably thinking about.
Are these liposuction or gastric bypass?
No, probably they had another thing, which is gastric bypass. Which is not an easy procedure. It's not my specialty in that, though. Yeah. But I think it's, yes, they lose weight first, like doing that, or by having a balloon inserted into the stomach. And then afterwards, liposuction, downtime after they lose a lot of weight, and they come with that excess area, and we do liposuction to them. We tighten the skin if possible. If they have too much laxity, then liposuction alone is not enough. Then they would need to have tummy tuck or surgical procedures to tighten the skin.
And these involve cutting off the
excess skin and suturing that back.
Suturing it back. Yeah. And what about the scars in this case?
The scars in this area, yes, we can handle that by doing some lasers for this to minimize the scar. The scar is there, but it's usually in a hidden area, like creases, under the clothes, under the panties. It doesn't show very much, especially if you do it in the right way.
But doctor, I would like to ask you is, what about how long does the procedure normally take, and what is the recovery time for the patients?
Usually the procedure extended from 2 to 6 hours, and usually we do patients under sedations, not general anesthesia. Because general anesthesia, after general anesthesia, the patient might feel noxious, tired, and this, it's by itself, it adds to the morbidity of the patient. So we try to do most of the patient under sedation. It works very nicely. The patient wake up without any, without feeling sick after the surgery.
So sort of going to the dentist.
Yeah, absolutely. And they walk away. And they walk away after the surgery. After the surgery. They can go to work. They can go. No, not right away. Not right away. If it's a small area, yes, they can go to work next day. Like the chin area, if they do the arms, they can't drive though if they did the arms, and like small areas. But if they do like the torso, like some picture I probably would show you now, like the torso or the back. So those patients, they can't go ahead to work the same day, but they can walk away from the clinic, right? And they can go back to work in 1 week.
And there's minimum pain these days.
Minimum pain, minimum hassles, and downtime, recovery downtime.
Oh, that sounds good.
There's some pictures probably.
If the director can show us some of the pictures that we have.
Right. So this is one of my patients who is previously used to go to the gym, and then he left the workout, and as you can see, he came bothered with his tummy and redundant skin of his breast and waist. And this is before. We can see the after. And this is exactly the same patient after 3 months without going back to the gym. When he came to me, I thought, yes, did you go to the gym? That's the first thing I asked him, and he denied this. And this is only after 3 months, and only by adding, see the shadows, you can see the shadows here and the waist. As you can see, what we do, we take the fat around the muscles out, and we add the same fat, because fat is like gold. So we don't throw out the fat. We add it into, we inject it into the muscle, and that's what we call 3D and 4D. Right? When you do the definition,
under the muscle?
Inside the muscle. Inside and above the muscle.
What does it achieve?
This will achieve muscle bulk.
Oh.
As you can see, like what you call the six packs, those, the muscles that we really inject, you can feel normal feeling of the muscle without indentations, without abnormality or irregularity, as you can see. And we take the fat around it. We do like, as if you're drawing a portrait. You're doing shadows and light, right? So you aggravate what you have, it's supposed to be bigger, and you take the fat around it. This is actually was about 3 months after surgery.
And you can't actually see any scars, huh?
Yes, it's we just do a small one, a small opening, like 2 millimeters at below.
Is this the same patient or someone else?
This is the same patient from the side. You can see, and now we can see the after as well.
After picture.
Yeah, the next picture. Yeah, this is the same patient, the same position, and after 3 months, and without going to the gym.
Oh, that looks good.
Yeah, yeah, it's a different perspective of liposuction.
Well, doctor, now talking about like the scientific part of fat.
Yeah.
It took that person 3 months to go from that look, from the before and after. It was 3 months.
Yeah, even before, like you can start seeing results.
Well, I'm sure that was
earlier.
I can make probably a month, maybe.
You can start seeing that in a month, yes, and you consistently seeing results until 6 months.
But how fast does fat burn? I mean, what is fat? I mean, when you take it out, it just looks like
like fat, like whitish, yellowish, slightly thicker fluid.
And so
like a milkshake, you know?
Like a milk. I don't want to. Now I can't drink milkshakes anymore. Thank you. So now, when people, I mean, that was very impressive what that person did. I mean, 3 months with no workout and looking very good.
Looking really fit, right? Like ripped.
Exactly.
Yeah.
But if a person were to work out, how much time would they need to achieve that transformation? If a person were to do it through exercise and diet?
We encourage patients all the time to go to the gym.
I'm sure he's going to the gym now.
So to keep those results, to keep those results and to have it all the time, you need to go back to the gym to keep those results, because the fat usually will go away, and the stem cells which generates the muscle fibers and the muscle cells will start to kick in. And the muscles will be a permanent results for him. But in order to make it bigger and to keep it nourished, he has to go to the gym.
Well, Dr. Nedhal, Ayyub, I'd like to thank you very much for being with us on the program.
Thank you actually for having me here.
Thank you so much.
All right.
And that was our guest, Dr. Nedhal, Ayyub, a cosmetic and surgical dermatologist, talking to us about the new techniques in liposuction, how it's become quite easier and less painful on patients today. We're going to go on a report, and we'll be right back to introduce our second guest for the evening, who is Dr. Nadir Al-Kinani, talking to us about reckless driving. Stay tuned.